Welcome everyone. I'm excited you're joining me for this very important topic, why functional medicine or functional nutrition. I'm Teresa Rispoli, Doctor of Clinical Nutrition, acupuncturist, functional nutritionist, and founder of FunctionalNutritionistAcademy.com, where I teach a certification program called Mastering Functional Nutrition. And I'm also the founder for Complete Health Institute, a wellness center located in Agoura, California, where I've been in a successful practice for over 27 years. I'm passionate about what I do, and I decided to pay it forward and help you learn the tools and principles of functional medicine and nutrition, which I use in my wellness center every day to solve my patients' chronic health conditions. I want you to understand the difference between conventional medicine and functional medicine or nutrition. So get a pad and a pen because you'll want to take notes. Also, if you stay to the end, I'm offering you a very special gift that will help you further understand how to solve chronic health conditions naturally. So let's get started with current conventional medicine. The National Institutes of Health define conventional medicine as a system in which medical doctors and other healthcare professionals treat symptoms and diseases using drugs, radiation, or surgery. The approach to chronic conditions is where conventional and functional medicine begin to differ. Let's take a look. Unlike conventional medicine, functional medicine and functional nutrition focus on identifying and addressing the root cause of disease, not just symptom treatment. Functional medicine examines every factor involving symptoms, genes, environment, and lifestyle factors to treat the cause of the disease, or the root, not just the symptoms. Functional medicine was developed based on the understanding of the importance of an individualized approach to illness, based on the evolving research in nutritional science, genomics, and epigenetics, according to the Institute for Functional Medicine. Now, at the heart of functional medicine lies the understanding that when the underlying causes are not addressed, problems can progress and worsen. I've found time and time again that the root of most chronic conditions is a consequence of lifestyle factors such as poor diet and stress, unresolved stress. The body is well equipped to heal itself. However, a poor diet and excessive internal stressors interfere with the body's ability to heal naturally. Now, the following factors are what truly set functional medicine apart from conventional medicine. So, functional medicine focuses on causes of symptom treatment. It's a holistic view of the entire body rather than a collection of separate systems. It examines the body, mind, and spirit connections to determine both physical and emotional aspects of disease. It improves the body's innate healing ability. And it partners with patients, allowing both parties to actively participate in treatment. As we've discussed, the goal of functional medicine is to determine the root cause of an illness or disease in order to treat the cause or the root of the symptoms. Functional medicine uses the symptoms as a clue to discover something hidden deeper. Picture a tall oak tree and imagine what we see above the ground as the symptoms of disease. The extensive root system below ground is less visible, but no less important. The root symbolizes the cause of disease, and functional medicine takes into account both the seen and the unseen systems of the body in order to understand how everything works together. In acupuncture, we have a saying, treat the root and the branches will prosper. When it comes to chronic conditions, getting to the root of the problem is the best approach for getting lasting results. Now, functional medicine utilizes a personalized healthcare approach to treat the root, not just the symptoms. As each of us are genetically and biochemically unique, functional medicine supports the body's natural ability to heal rather than tackling disease directly with medicine. Research shows disease and illness are composed of a complicated network among various systems in the body. Functional medicine utilizes this science to understand the web-like relationships among these systems, then applies key principles and functional medicine tools to tap into the body's natural ability to heal and even in the prevention of many diseases. Did you know that health is defined by the World Health Organization as a state of complete physical, mental, and social well-being, and not merely the absence of disease? Functional medicine has been proven to help a wide range of conditions, including cardiometabolic conditions like diabetes, high blood pressure, and heart disease, neurological and psychiatric conditions like depression, attention deficit disorder, and migraine headaches. It treats digestive disorders like irritable bowel syndrome, ulcers, chronic pancreatitis, acid reflux, and diverticulosis. It helps reverse autoimmune diseases like rheumatoid arthritis, lupus, and Hashimoto's thyroiditis. It helps with skin disorders like psoriasis, acne, and eczema, and hormonal problems like thyroid conditions, chronic fatigue, or menopause. Now, the main goal is to repair and restore the body's natural ability to heal by restoring system balance. Since each of us is different, our care plan should be unique. In the functional medicine model, care plans may include lifestyle changes such as diet and exercise, stress reduction and management tools, detoxification programs, nutritional supplements, and botanical remedies. Each plan developed between a patient and a functional medicine health professional aims to restore imbalances causing a specific condition or prevent chronic conditions from occurring in the first place. A study published in the Journal of Health Economics, The Value of Disease Prevention versus Treatment, found that the demand value of prevention always exceeds that of treatment. Disease prevention is the process by which anticipatory actions can be taken to reduce risk factors known to lead to specific conditions. Now, millions of individuals die each year from preventable conditions, including heart disease, cancer, chronic respiratory disease, stroke, and diabetes. Did you get the part where I said preventable conditions? That's where functional medicine can help. Now, a study published in the Archives of Internal Medicine reports significant results for those following 4 different lifestyle changes. The study followed 23,000 participants adhering to only 4 behavioral changes, and these are not smoking, exercising only 3.5 hours a week, eating a healthy diet, and maintaining a healthy weight. Now, these behaviors alone attributed to 93% diabetes prevention, 81% heart attack prevention, 50% stroke prevention, and 36% cancer prevention. Another study published in The Lancet followed 30,000 participants across 52 countries. Similar results were reported with a 90% prevention rate of all heart disease with lifestyle changes. Note that these are just 2 examples of the ever-growing body of research on the effects of diet and lifestyle changes resulting in disease prevention. That's pretty amazing. Now, there's many factors contributing to heart disease, I would agree. While genetics contributes to some degree, many other factors are within our control. Have you ever heard the term genetics loads the gun, but environment pulls the trigger? We are part of our environment. Aspects such as high blood pressure, high blood sugar, or abnormal cholesterol are contributing factors to heart disease, and these are often treated with medication. However, studies have increasingly shown that treating these risk factors has only little benefit or none at all. Lifestyle changes are the most effective tool for preventing contributing factors. thus significantly reducing the risk of heart disease. Now, a note on medications. While medications certainly have a place, a study in the Nutrition Journal compared treatment with statin drugs to a diet rich in fiber, almonds, and plant cereals for lowering cholesterol. The study found similar rates of cholesterol reduction. However, the dietary changes also reduced inflammation and homocysteine levels. So again, diet and lifestyle changes. Functional medicine utilizes the following modifications for preventing and reversing heart disease in some cases. You want to eat your phytonutrients. Try getting 8 to 10 servings of colorful fruit and vegetables to maximize the disease-fighting benefits of vitamins, minerals, fiber, antioxidants, and anti-inflammatory nutrients. Stabilize blood sugar by incorporating small amounts of protein, healthy fat, and healthy carbohydrates at every meal. Get more fiber. The average American adult is only getting 15 grams of fiber. Work your way up to 50 grams by incorporating high fiber foods such as vegetables, nuts, seeds, and legumes. Ever wonder why processed foods have such a long shelf life? Well, processed foods are packed with all sorts of chemicals and dyes and are lacking in essential nutrients. So eliminate them. Eliminate foods with hydrogenated fats such as margarine, shortening, processed oil, and many baked goods and processed foods like cookies and crackers. Instead, opt for foods with healthy omega-3 fatty acids, so fish oils. Now, mild anxiety is a normal part of life. However, when anxiety doesn't go away, it can interfere with daily life, wouldn't you agree? Functional medicine takes a look at root causes of anxiety. Let's discuss a gut pathology contributing to anxiety. Your gut bacteria produce calming serotonin. Instead of suppressing symptoms through prescription medication, functional medicine examines the underlying causes. Even if anxiety is caused by an imbalance in neurotransmitter activity, what is the cause of the neurotransmitter dysfunction, you have to ask yourself. A functional doctor may start by examining the gut, because the body of evidence linking gut health and brain health has skyrocketed. Gut inflammation, small intestinal bacteria overgrowth, and fungal overgrowth, among other issues, can affect the brain. Additionally, serotonin, a key neurotransmitter, is produced in much higher volumes in the gut than the brain. Some doctors even argue that the gut is our second brain. It's recognized that dysfunctions in the gut can lead to a variety of cognitive, mood, and behavioral disorders, including depression and anxiety. The link between nutrient deficiencies and disease cannot be overlooked. Your functional medicine doctor or functional nutritionist will most likely want lab work on your blood and urine nutrients to determine if there are any deficiencies of B12, folate, zinc, copper, EPA-DHA, vitamin D, B6, or riboflavin, because they all play an important role in mental health and neurotransmitter activity. Shellfish and organ meats are highest in many of these nutrients listed. Now, our skin is the largest and most visible organ of the body. Did you know that your skin can reflect deeper issues of health like leaky gut? One of the most common chronic skin conditions is eczema, an inflammatory skin disorder that results in red, dry, and itchy skin. And dermatitis is an acute skin condition with much of the same or similar symptoms. Skin infections, on the other hand, can be caused by a virus, bacteria, or fungus. And some forms of viral skin conditions include herpes, shingles, and warts. Bacterial infections can spread to other parts of the body, such as cellulitis. And athlete foot and ringworm are examples of fungal skin conditions. Now, antibiotics are commonly used to treat infections. However, they can weaken the immune system and lead to chronic conditions when inappropriately used. Thus, functional medicine finds treating skin conditions from the inside out is a better way to address the root problem. So functional medicine treatments may include things like tea tree oil and coconut oil, because they're potent antifungal agents that can be applied to the infected skin after showering. Witch hazel and chamomile are also great anti-inflammatories to apply to acne spots. And apple cider vinegar is an ideal treatment for fungal infections. If poor nutrition is thought to be a culprit, you can try ruling out common food allergies or intolerances. Increase your intake of anti-inflammatory foods, which are high in vitamin C, bioflavonoids, iron, carotenoids, and vitamin E. And it's important to stay hydrated with water. And your immune system, in order for it to be strong, you must avoid processed foods and foods high in sugar. Now, cortisol is noted as a potent stress hormone produced by the adrenals and a major contributor to a number of chronic conditions. While cortisol plays an essential role in circulatory function, excess levels can be deadly. Elevated cortisol can cause insomnia, insulin resistance, and hormone imbalances. Many studies have examined the relationship between stress and health, and the results are very alarming. Some well-documented negative health results of stress include damage to immunity, increased risk of diabetes and obesity, poor cognitive function and focus. Functional medicine can help through various outlets. First and foremost, by addressing the underlying cause of stress and applying dietary modifications, exercise, relaxation techniques, and stress reduction, as well as nutrients, because stress really robs the body of quite a few nutrients. Our world is burdened by an alarming amount of toxins in our food, air, building material, and our water. Through functional medicine, you can aid the body's natural detoxification process in unburdening itself. The liver, for example, is the major organ of detoxification. When the system becomes overloaded with toxic agents, they can spill over into the blood, accumulate, and get trapped in the body, especially the fat. The purpose of a detox program is to reduce the burden of toxic overload on the liver and digestive system by allowing it time to heal, anywhere from a week to a month, so it can once again function optimally. Additionally, it's important to support the detoxification pathways with the proper and necessary vitamins, minerals, and micronutrients. Your functional medicine practitioner or nutritionist will help you determine foods to avoid which cause excessive inflammation in your body while you're on a detox program. Many patients wonder if they can get all the nutrients they need from diet alone. Ideally, food would provide everything we need. However, there are several factors causing diet alone to not be enough. For example, our depleted soils, the storage and transportation of food, and genetic alterations all impact the nutrient content of everything we eat. Examples of conditions requiring additional supplementation include obesity and diabetes. Both conditions are a result of malnutrition. Essential vitamins and minerals are needed to restore balance in the body's functions. Specific supplementation measures will be discussed between you and your functional health practitioner. Depending on your current state of health and healthcare goals, supplementation programs will differ. This is the wonderful thing about functional medicine. There's no one-size-fits-all approach. Every level of care is developed specifically for you and with you in mind. So when visiting a functional medicine practitioner, you can expect your visit to take a bit more time than it would with a conventional practitioner. Functional medicine practitioners are looking for in-depth information regarding your personal and family history and the circumstances around your first symptoms. Like what happened when you got your first symptom? As the goal is to uncover the underlying cause of your health problems, a detailed history, physical examination, and laboratory testings may be necessary to provide a full picture. This may seem like an initial investment, but it's worth the time to get to the root cause rather than treating symptoms, which can lead to recurring conditions. Wouldn't you agree? So for more information, I urge you to visit https://functionalnutritionistacademy.com. Here you can learn how to become a certified functional nutritionist online in your own time. I urge you to join now and become a leader in your area and help resolve chronic illness naturally. Now, to book an appointment with Dr. Rispoli, you can visit CompleteHealthInstitute.com in Agoura, California. I want to thank you for joining us. We hope this topic on why functional medicine or functional nutrition has provided you with some useful information and that you feel ready to schedule an appointment. We're always here to help guide you. Now, remember I talked to you about getting your free gift if you waited till the end? Well, to get your free gift, all you need to do is go to functionalnutritionistacademy.com and where it says get your free report on solving chronic illness today, go ahead and subscribe there and you'll get your free gift. Look around the website and I urge you to join. Register now. Registration doors are open. We'll talk to you soon. Bye now.